Good evening, everyone, and welcome to the March 2021 NATS Chat. I'm Kari Reagan, moderator of NATS Chats, which are sponsored by Inside View Press, and tonight co-sponsored by the Voice Foundation. And therefore, my dear friend and colleague, Peggy Baroody, is co-hosting with me tonight. Thank you, Peggy, for being here.
Thank you, Kari, for having us. We invite everyone to join us for a virtual symposium this year for the Voice Foundation, one more year online, June 2 through 6. Love to have you there.
Thank you, Peggy. I'm so glad you mentioned that. That had to have been a hard decision about whether to go online or not. So
a lot of debate.
I bet. So tonight, I am so pleased to welcome my esteemed colleagues, Dr. Mary Sandage and Dr. Erin Johnson from the speech language pathology community. And by way of a very brief introduction, let me just share a little bit of the bio. Mary Sandage, PhD, is an associate professor and director of voice physiology laboratory in the Department of Speech, Language, and Hearing Sciences at Auburn University. Dr. Sandage earned her PhD in exercise science at Auburn University School of Kinesiology. Her research interests merged the disciplines of exercise science and voice science for a focus on voice and upper airway physiology. Welcome, Dr. Sandage.
Thank you.
And Dr. Erin Johnson, PhD, is Associate Professor of the Department of Otolaryngology, Head and Neck Surgery, and the Department of Rehabilitation Medicine at NYU Grossman School of Medicine. His current research investigates the effects of vocal training, voice use, and aging on the muscles of the larynx. The aims of his research is to understand how vocal training can improve vocal function in older adults. After a decades-long career as a professional classical singer and singing teacher, he shifted his focus from the artistic use of the voice to its medical treatment and became a speech-language pathologist. So again, we are so honored to have you both here with us tonight.
Well, thank you so much for the invitation. We're happy to be here.
Yeah, and we're going to talk about planning and managing for voice fatigue, which is such a relevant and always interesting and hot topic. Let's begin by simply defining voice fatigue.
Erin, would you like to start?
Sure. All right. Pause. So Mary and I are both very interested in the muscle. And when we think of physical activity and fatiguing with physical activity, most of the time we are talking about muscular fatigue. It's much more complicated, however, in the voice. So we, again, Mary and I are sort of in the minority of folks that are really interested in those deeper layers of the muscle of the vocal fold and trying to understand their contribution to vocal fatigue and understand how they change with training and with aging. Lots of other people, rightly so, are interested in the outer vibratory layers. And part of what contributes to the perception of vocal fatigue, and maybe I should actually just sort of step back and say that that really the only way at this point that we can measure vocal fatigue has to do with the self-perceived vocal fatigue. Someone saying, yeah, it takes more effort to get my voice out. My voice is tired by the end of the day. And there are some tools we use clinically that are relatively recent that measure vocal fatigue as it pertains to the patient's perception. But when we're talking about sort of the underlying physiology of vocal fatigue, we do think that muscular fatigue is a component of vocal fatigue, although we don't really have a great understanding of exactly how it contributes. But then those outer layers, as they vibrate, they're also colliding with each other. And those collisions can cause swelling and potentially can cause then an increased perceived effort or actual increased amount of airflow or air pressure needed to get the voice going. And that, again, increased effort then is perceived as fatigue. And then we also have other cognitive aspects of vocal fatigue. So again, all this has to do with the way the patient is perceiving how much effort and energy it takes to get their voice out. So there are cognitive aspects of having to do a skilled task, particularly if we think about singing and the demands it places on the coordination of producing the voice in a very athletic and highly specific way and repetitive way. And for many singers, if they're doing many shows a week, then that can add a level of cognitive fatigue to that task as well. Mary, what did I miss?
That was really good.
Yeah, that was very comprehensive. What I would just say is, you know, I was a clinician and singing teacher for many years before I got my PhD in exercise science, and I'm sitting in class hearing about the very well-established muscle fatigue paradigms that have been established in measurable ways we can't really measure fatigue in laryngeal muscles in the way that we can measure the fatigue in the muscles of the arms and the legs. And it made me think, why have we not been applying this same science to voice fatigue? You know, there are skeletal muscles involved as well. And as you know, Aaron explained, it is a different structure because of the layer structure and the collision forces that are involved, which are unlike limb skeletal muscles. And it also helped me understand why anecdotally we observe fatigue. We see classroom teachers that take summers off. We see performers that go on hiatus. And there is a process of getting back in shape to do the work that is required of a classroom teacher or a performer. And from an exercise science perspective, this idea of strength and conditioning training, of training up for the task so that you're fit for the task, I mean, is something that we haven't really operationally defined. We don't have performance fitness assessments for voice like we should. I think we're all nibbling around the edges of it and trying to amass data about vocal dose and what that means and how we can train up to vocal dose. So I think it's very timely that we start to think about fatigue of the intrinsic laryngeal muscles and respiratory muscles as well, because you know, maintaining those higher subglottal pressures for singers in particular and actors, that is something that also requires muscles in the respiratory system as well. So I think it's a pretty physiologically complex topic that, unfortunately, as Aaron pointed out, we're only really able to measure perceptually at this point, but it is something we need to be paying attention to for sure. Mm-hmm.
I know I've told you this, Mary, before, that you were the first person I ever heard talk about respiratory fatigue with singers several years ago. And I can't believe that hadn't occurred to me. And so you're not seeing a lot of research specifically with regard to that at this point. And are you feeling that when singers have voice fatigue, it might manifest as voice fatigue, but the respiratory fatigue might be a part of that? Or would you think that there would be specific sensations, kinesthetic feelings around respiratory fatigue specifically?
You know, I don't know that we have a way of uncoupling the two from each other in the context of extensive voice use, because they are so, you know, they rely on each other. And I would love to see some science emerge, some really good empirical studies trying to tease out the role of the respiratory system minus, you know, plus the phonatory system. And I think that there's some emerging research that's going to start to look at that. You know, and I think it's important to think about how the respiratory system might fatigue, especially for our extensive performers. You know, the classic clinical situation that I could describe in my experience is the singer who's been advised by their singing teacher to go on voice rest. That doesn't resolve the problem, so then they go see their physician, and then by the time they get to their primary care doctor, then they get to the ENT, and maybe they get to a voice center, and then they get to someone who does singing rehab. They've had many weeks of voice rest, and the idea that the voice is this, you know, this resource that you can just access at any moment as extensively as you want without risking injury is, you know, we just need to think about that. And so what I ended up seeing was deconditioning, not just of the voice, but of the ability to you know, tune the vocal tract and to support it with respiratory muscles as well. So I think if we can think about avoiding deconditioning, you know, like during recovery from a surgical intervention, perhaps. I mean, I've talked a little bit about this before, about using, you know, semi-occluded vocal tract exercises to help keep the respiratory system and the laryngeal system engaged in a certain exercise dose while avoiding edge collision forces, you know, with the tissue healing. And we've seen some lovely preliminary evidence from, I think, Ryan Bransky and Kitty Verdolini on tissue mobilization of the vocal fold tissue after surgery to show that it's actually has less inflammation, which kind of makes sense when you know about muscle recovery with muscle injury, right? The body wants to heal itself and wants to maintain homeostasis. So If the tissue is not being engaged, then the body might not be triggered to heal it and restore it, right? But if you're engaging the tissue, then the body's going to be in the business of keeping that tissue fit, right, and ready to go.
And I'd say that's a change in rehabilitation sciences relatively recently. Mary, you probably know sort of when that shift happened, but if anybody's had a limb or arm injury in the past decade or so, it used to be that, okay, put it in a cast and rest it up and don't move for however until it heals. And
Yeah.
that's not the case anymore. The science now is that we want to mobilize, we want to move, and that helps promote healing as opposed to just staying off that injury.
Yeah,
Now,
so wearing a boot when you break your leg triggers the bone to knit and heal stronger than doing an unloaded condition, which we all used to be on crutches, right? Don't put any weight on your foot if you broke your tibia or fibia or what have you. And now it's a very different paradigm. And I think that's a great thing to think about with voice as well.
I just do want to qualify that I'm not saying that if you're vocally injured, you shouldn't rest, right? That we have to understand what the injury or what the fatigue is. So if someone has an injury to the outer layers of the vocal folds, a vocal fold hemorrhage or a recent surgery,
Yes.
or they're developing nodules, then yes, there are appropriate times to decrease or even completely go on vocal rest. So I just to clarify, I didn't mean to always just use your voice as much as you want, no matter what. That wasn't my point.
Well, and a lot of what Aaron and I talk about, there's an assumption with this basic advice that the larynx is healthy and that the individual doesn't have some other health condition that might be contributing to the perception of fatigue, like myasthenia gravis, or some other conditions that actually have muscle fatigue as a feature of the disorder.
Before we go further down the voice fatigue path, I want to just ask a question about, and Mary, I think it was an article you and Matt wrote, Matt Hoch, about we want to be mindful when adapting exercise science to singers. Can you just talk a minute about that? Because I think that's such an important topic. We don't just automatically take that research and adapt it to our field.
Well, and I think as Aaron's work and the work of some others, I mean, we know that the intrinsic laryngeal muscles are skeletal muscles, but we have to be really careful that we don't assume that the research done on arm and leg muscles that are also skeletal muscles apply directly to the larynx, because the larynx number one job is an airway protector. So it has a very different role than the muscles of the arms and legs. We also have not really worked out what the bioenergetic system is in the intrinsic laryngeal muscles. And so there's a lot that we don't know about fiber type, I would say, about how these muscles make fuel and use fuel, how fatigue resistant they are. We would expect them to be probably more fatigue resistant because they have to be ready to protect the lower airway. But we also shouldn't assume that they're non-fatigable. All muscles are fatigable, right? But some to a greater degree than others. So there's a lot of basic research we just don't know. Now, Aaron's basic work is incredibly important to understand how neuroplastic these muscles are in response to exercise and with aging. I think, Nadine Connor's group has also done some really foundational work, which that's the lab Aaron came out of. But I mean, I can't think of more than 3 or 4 cadaver studies that have actually described the muscle fiber types of the intrinsic laryngeal skeletal muscles. And so there's a lot of basic knowledge that we don't know, that we need to know before we can start working on these programmatic, methods for conditioning and fatigue resistance and those sorts of things.
Mm-hmm.
If I could just piggyback on that, or maybe just take a step back, because I know we have a variety of folks in the audience. So the muscle fiber types that Mary was referring to, very broadly. So when you have a muscle, it's composed of individual fibers, and broadly they're categorized into fast and slow muscle fiber types. There's some subclassifications as well. The slower muscle fiber types tend to be more fatigue resistant, so they don't fatigue as quickly. So those would be the muscles that you would rely on for long distance cycling, or our postural muscles that are always active in responding and always keeping us upright. Those are the slower muscles. They don't need to produce as much force and they don't need to move as quickly, but they need to always be engaged. The fast muscle fiber types are larger, they're more powerful, they're faster, hence their name. And the larynx, and you would think of those as more ballistic activity, so throwing something very far where you need to generate a lot of force very quickly. So the classic is the marathon runner versus the sprinter, right? The slow muscle fiber types, fatigue resistance in the marathon versus the sprinter who has more of the fast fiber types to generate those very fast ballistic forces. So the laryngeal muscles have been shown to be a hybrid of those because of the function, right? So the form follows function. The larynx, as Mary mentioned, needs to rapidly close in order to protect the airway. We need to, if you've all experienced that, if you ever cough, something goes down the wrong tube, that's the larynx doing its job. And those muscles are rapidly closing and making sure nothing goes down into the lungs. However, they also need to be able to be engaged for long periods of time. And so they are fatigue resistant to a point, but eventually fatigable. And that's what we're trying to sort of get to the bottom to, is what is the balance of these fiber types? How fatigable are they? Are the short little contractions as I'm speaking, are those enough to fatigue those little muscles? Is it the collection of all those muscles firing over time? So thinking about the vocal dose, how long I'm speaking, does that fatigue it? Like I can only cycle for so long before my fatigue resistant fibers start to fatigue eventually. And those are the kind of questions related to the muscle fibers that we're trying to understand.
But here's what's cool, is we know, at least with limb muscles, and I think we could speculate it might also occur with muscles we use for voicing, that you can train a muscle to be more fatigue resistant through a training program, right? Because you never contract all the muscle fibers in a given whole muscle at one time. And so the body learns, like, some people call it muscle memory. I call it motor learning, right? As an educator. But basically you learn how far and how fast the muscles need to go, right? So you can think of any vocalese that you're doing. You don't want to overshoot it or undershoot it, right? And the muscle learns to cycle through the fibers as a strategy for becoming fatigue resistant over time. That just blew my mind when I learned that, right? And then the other thing that is, your body fatigues. One reason it fatigues is because it runs out of substrate to make the fuel that the muscles need to vibrate. And so if you don't have whatever you need on board, right? Whether it's glycogen or glucose in your blood or other materials, ingredients to make the energy source for muscles, then you're going to fatigue. And the training, right? Up-regulating with training, your body learns to have more available materials to make more ATP. So there's these very basic physiologic changes that occur and up-regulate to support the dose that you're demanding. And that's where some of the fatigue resistance comes in. And so if I think if we're skillful about how we plan training, especially training up for, like Matt and I published a paper on his training up for a 70-minute Schubert recital with no intermissions. The vocal dose was almost the same as a classroom teacher, an elementary school classroom teacher in the classroom for 8 hours, but he did it in 70 minutes at, I don't know, 90 dB average. So his dose was quite high in a short period of time. And he did, it took him a year to work up to be able to do that. He didn't just do it. And so we've got to think about it, I think, in some of those ways to help people avoid injuring themselves because they're recruiting and straining to help get the job done.
We have a great comment from your colleague, Sandy Hirsch. She says, and then presumably the dosage of a reset with some SOVT approaches is part of the question as well. In other words, what is the optimal frequency of the reset for fatigue resistant?
Well, I see the reset as a different thing than, fatigue is fatigue. In fact, I'm troubled by this idea that a warm-up can mitigate fatigue. The warm-up is part of the whole load. Right? The depletion of the locally available energy stores starts when you start warm up, right? It's part of the whole aggregate, right? The reset I see as once you've recruited extra tension, it's reminding yourself, wait a minute, I can produce that voice more economically without all that extra tension. I see it as a reminder to get back to the basic, to get back to excellent technique is how I see it. And then you can probably go a little longer then you're probably gonna have to reset again before you can finish your day. But as you work up to being able to do a longer dose, you should probably have to reset less. So I see reset as a strategy, like on your way to, because no one, I mean, classroom teachers don't have the luxury of taking a month to get in shape before class starts, right?
Mm.
So they've got to have something to help them get in shape while they're on the job.
No, just again to piggyback on what you're saying, Mary, which is great. This reset idea from a clinical or training standpoint, the idea of micro resets is something that I work with a lot. I use the word release, and I use the word release to refer to the inhalation, because if we're thinking about singers, particularly I know young singers, they're working hard to learn new repertoire and they're still emerging in their technique. And what I've noticed, and I noticed this in my own voice when I was a young singer, is they'd reach the end of a song and it would feel like, boy, I'm going to pass out. I'm so exhausted from singing one song. And so, what I tell my students is every time, and my patients, every time you breathe, that's an opportunity to release. And if you think about, again, sort of the exercise, reboot, release, reset, whatever, something. But if you hold your arm, if I hold my arm out here for the rest of the talk, this is not stressing my muscle. It's not using a lot of contraction. But in 40 minutes, my arm is going to be sore, and that's what we do. People, they don't necessarily, right? If they breathe in, and they're always kind of staying in this hyperactive state, you're never giving those muscles a chance to just simply release, relax, reset, reboot for a moment. So those micro, I think that's a good sort of quick strategy to use with singers who are training to sing demanding repertoire, or even young singers that not that demanding but demanding for them, and need to find ways to release some of that tension and not fatigue by the end of a song.
I was going to bring this up later, but maybe now's a good time. I am a big water bubbler or water resistant therapy, whatever, water cup bubbles. I mean, there are 100 names, unfortunately, for it. Tube in water. And I love to talk to my singers that are injured about just throughout the day, reset with water bubbles. I really love that feeling of, it feels like a little bit of a laryngeal massage. And I know, of course, Marco Guzman's work and many others where different tube materials can have a different impact on kinesthetic sensations. But do you want to just take a minute and talk? Are you lovers of water bubbles, water resistant therapy, like I am anecdotally?
I've been doing this for a really long time before the straw became popular in the US. And so I've never really relied on straw and water. I also like to give them something where they don't have to have a straw or water. So my favorite that I learned from Janet Alcorn when I was studying with her as an undergraduate singer is that what I call a tongue bubble.
Raspberry, okay.
Well, it's not a trill because the trill's inside the mouth and the trill has more tongue tension, I think, than this does. This also promotes really nice jaw release and base of tongue release for people that have those problems. And it takes a lot of coordination of respiration because it's an air waster, right? So I like to do, I tend to do more things like that. I absolutely use water. I absolutely use straws. I mean, I use whatever it takes that the person will do, frankly.
Yeah, the whole range of SLVT, yeah.
Yeah, but so for me, anecdotally, again, the water, there's something about the oscillation of the water bubbles in the tube that just has, it really, for me and for my students self-report as well, it has a different feeling of a massage on the larynx. So anyway, I just wondered, how about you, Peggy? I'd love to know from you.
Thank you. I was just going to say that I think it's incumbent upon us as voice teachers and as clinicians to understand how to teach all the different methods of SOVT, because in my experience, people respond differently to different exercises. Some people are adept at lip trills, some people are terrible, some people are adept at, some people are awful. And when time is of an essence, then you've got to try to pull from the toolbox, understand least to greatest intraoral pressure, understand the mechanics of it so you can make your choices. I've got some singers that have miraculously benefited from straw and water, others for whom it's not been good, even while monitoring the way in which they do it. Some people do well with just plain straw, others don't. So I think, I mean, personally, I keep an open mind and try to find one that works for them to help them reset or recalibrate. But one other thing I wanted to say was I love this conversation with y'all because once again, it's an example of how our advances in voice science and the information we are gaining is validating traditional voice pedagogy concepts that have been practiced for 300 years.
Yes.
When you were talking about building up endurance for a performance, oh gosh, something you said, Erin. Oh, rats, I forgot it. But all of this,
I do work with rats.
Well, I love that component, you know, that element. I love connecting the two.
Singing. Yeah,
it's fantastic. So
yeah,
and rat choir going on in your lab.
I do have a rat choir. Yeah, no, Peggy, I'm glad you said that. That's, I mean, that's as someone who taught for 10 years, and when I got into the science of the voice, that was what's so compelling for me, is it was starting to help me understand things that I was already doing and things that were working, or maybe help explain things that weren't working as well. And sort of, so I think that we've come a long way in the years since I've gotten into the science aspect. I think that there are far more people that are accepting. I mean, clearly, right, NATS has really turned a corner in the past 20 years in terms of inviting science and encouraging science. So I think we're in a really great place as a multidisciplinary community.
Yeah.
Just speaking to the voice teachers who are here tonight, I would really encourage you not to be afraid of voice science and afraid of the language that we sometimes don't understand, and know that if you can understand the principle behind an exercise, you can use it more effectively and you're a better teacher. And it takes some of the pressure off, of being a voice teacher and trying to find ideas and answers for something that is almost metaphysical.
Oh, that was well said, Peggy. Thank you. We've got some great questions coming in, but let me ask one before that somebody sent to me ahead of time. What are the primary behavioral causes of voice fatigue, and how might you address them?
Well,
Erin, I like your bank account analogy that you gave.
oh, no, it's not mine, but I like to use it. Yeah, Tom Cleveland is the first person that I heard talk about it. The idea of your vocal bank, that there's only so many sort of vibrations per day that we all get before we start to fatigue. Although we could, so particularly for it's nice for performers, because you can say, if you're going to use your voice, you're going to be spending your voice, as the money analogy here, that you should be getting paid in some way to be spending your voice. And that payment could be in actual dollars in a performance situation, or it could also be social capital, right? You're not going to say never talk to your friends again because you're a professional voice user. That's not what I mean. But be conscious that when you are using your voice, you are spending some of your voice that day. We don't really know. I can't say there's X number of vibrations that's the appropriate amount. It really varies by person. I mean, from what we've talked about tonight, thinking about training, right? You're going to fatigue less if you are trained and used to that activity. But it comes down to how much and how you're using your voice. Those are the primary elements of fatigue. There may be some other aspects as well related to sort of the vocal hygiene aspect. Hydration is important, obviously, but I think that for the most part, the vocal hygiene aspects are oversold in their importance. And that's because I think they're easier to manage, right? I can drink more water, but for me to go train and figure out how to improve my technique, that's a lot harder than drinking water or popping a cough drop and those types of things. So I tend to emphasize just simply how much and how are you using your voice.
Yeah, I would also say that I think there's some people that are genetically predisposed to being able to use their voice extensively without injury, and other people are probably more vulnerable. Now, there's some lovely research that's been published looking at physiologic differences between people with smaller pulmonary volume having to work in a classroom and produce a louder voice, versus folks with a larger pulmonary volume. I think that those differences might matter. I think there's also some people that have chronic health conditions that might make it a little harder to make voice easily, like asthma, allergies, reflux, that all of those things we know affect how nice and wet the surface of the vocal folds are. And if they're drier, right, it might make it, you might need more intrinsic laryngeal muscle closure forces to get the vocal folds vibrating and keep them vibrating, which we usually measure in PTP, which phonation threshold pressure, which some of you know about. And someone had made a comment that I wanted to address too, talking about like cervical alignment. I think ergonomics are so vital, and sometimes all I do is fix ergonomics with someone and then their voice is not as fatigued. I think with our looking down at our phones and, you know, we just tend to not have great posture like we used to. So sometimes reminders about that, I think. And sometimes to free the voice so it comes out without tension, all I do is just lengthen the cervical spine with, you know, I just gently remind the person to have their head as tall as it can be, you know, be tall to the top of their head. You know, and I might even hold them there if they're super locked into pushing their chin out when they voice or when they sing. And that freedom that comes with that release can be just eye-opening, and for some people can be a real solution to a chronic problem.
We tend to be
topic.
related to that, we tend to be very laryngocentric in the voice world. So we've been talking about these tiny little muscles inside of the larynx that we're interested in related to vocal fatigue. But most patients who complain of fatigue are always talking about, you know, these muscles around here and in the neck, and they've got soreness in these much larger neck muscles. And Mary, I think that's dead on in terms of what are they doing with the surrounding musculature as related to posture. And one thing I tell my patients is these big neck muscles are not there to help your voice. They're there to make sure your head doesn't fall off your body. So
Right.
Don't make them work any harder than they need to. If your head is over, you know, your toes, then they're working hard to make sure it doesn't fall down and go down. So you can just get that alignment going. That's tremendously helpful.
I find too.
I just wanted to add along with that too, I think, is making sure that your sinuses are really clear. Because if your sinuses are filled with mucus, then you're going to be working physiologically harder to get the volumes that you need because you can't project your voice in the same way. So just, it's so interesting to me how upper airway health in general supports better voice production. So it isn't, sometimes fixing the voice is about clearing out the sinuses and making sure the sinuses are clear, right? I mean,
Mary, could you address specifically why full sinuses, specifically why that might hinder projection?
well, so that creates what we call a denasal kind of voice quality, right? Where the acoustic spaces in your nose, right, and in your sinuses, which are above your eyes as well and here as well, they're not available to help shape the sound that you're trying to create. And so you have this acoustic dampening that makes it harder to have a rich acoustic signal. So it is paramount, especially for our performers, I would say, and people that have to speak loudly for long periods of time, like classroom teachers, that they have this open so that they can get that ringing, resonant, projected quality that does take the load away, we know, from the manner in which the vocal folds need to close for louder voice production.
Excuse this is a stupid question, I think, but if the palate is up and the nasal port is closed, is that just sensation that we are losing, or is it actual resonance enhancement if the port is closed?
I would say it's probably both of those things. A lot of people get their kind of perceptual kinesthetic feedback of having achieved resonant voice by vibrations that are farther forward in their head. I mean, some people feel it here, some people feel it here, right? I mean, and wherever they feel it is fine with me as long as it's in front of their ears and above their chin. But we know that people that are denasal, like, I mean, I also work with cleft palate population as well, and the kids that are unable to access their nose, right, because their velum is completely closed, perhaps, or scarred shut. They also have trouble with loudness and end up squeezing more at the level of the larynx to achieve the acoustic boost that they need to be loud enough in the classroom. Aaron, do you want to add anything to that?
Yeah, I'll just say one thing about the palate. We're getting a little off topic with this, but it's interesting stuff. You know, there are a few studies that in classical and non-classical CCM singers, pardon me, that that show that the palate may not be as closed as we think it is all of the time. And certainly the singer's perception of a closed palate may not always be accurate. I mean, what we think is going on in our throat, unless we're using a scope or an MRI or something, we really can't be sure. And we can just look at sort of the long tradition of using analogies and imagery of feeling something in the back of the throat, whether it's an apple or a rainbow or a unicorn, that helps to make something change in the resonance. So I don't want to get us down this rabbit hole, but I think it's an interesting idea that certainly a change in the sinuses, if someone is sick or chronic sinusitis, that I think that changes the sensation for sure. And we know that the way we hear and perceive our own voice has a huge impact then on what we do to produce our voice. So I think there definitely can be a link there.
I also find with a lot of singers that have fatigue, and some with diagnosis of MTD or other things, but that the rigidity in their core muscles, in their abs, this kind of chronic state of rigidity. And I know I was doing a presentation, recording a presentation in December, and in the middle of my presentation, I thought, holy heck, my abs are so rigid. I'm not releasing them when I take a breath. So if you guys want to speak to that, do you find that common with people with fatigue?
Oh, yeah. I mean, I see quivering in the epigastric area, like right below where the sternum and xiphoid process end. I mean, if they're pulled, if they start pulling their belly in at the beginning of the line and then they keep trying to pull it in and in and in, it's almost, I mean, it's terribly fatiguing for them. And once they're in, there's no place to go. And so then they end up squeezing here. So sometimes the fix for the tightness here, right, is fixing the tightness farther down. So I'm a big proponent of more of an apagio type, where we work on rib expansion so the belly can release more and they don't end up holding tightness in their rectus abdominis, which when that's tight, this is tight. That's what we tighten to Valsalva to lift heavy things, right? So we don't want to overuse the abs, because we'll end up with tension right here because of that relationship.
Mm-hmm.
Kari, you mentioned muscle tension dysphonia, and I know there was a question that came up in the Q&A, and I just wanted to talk about that for a moment. Muscle tension dysphonia is an incredibly broad diagnosis that tends to be a diagnosis of exclusion. And by that, I mean the laryngologist will take a look at the larynx and no lumps or bumps, everything's moving okay, and this person is having a problem with their voice. Well, muscle tension dysphonia is sort of the default, assuming, I mean, that's a little bit generic, but that's sort of basically what oftentimes happens. And so you end up with people that have all sorts of different types of problems that fall into this bucket of muscle tension dysphonia. So I'm always a little hesitant to even use the term muscle tension dysphonia, because it can mean so many different things, and there's no sort of one treatment. There's not even a good way to diagnose it, quite honestly. There's no distinguishing characteristics and the acoustic signal, the aerodynamic signal, so it's a tricky thing. That said, what sometimes is called a functional voice disorder, where there's problem with tension and fatigue and soreness in the muscles in and around the larynx, and there's no obvious pathology, that kind of qualifies as muscle tension dysphonia. And the things that we just were talking about of releasing the tension in the abdomen with the breath, trying to find the alignment, addressing how and how much the person is using their voice, those are all sort of the general approaches for anyone who has some sort of muscular imbalance or bad habits, one might say, related to how they use their voice, that could be contributing to their voice problem.
And I'll just add, it's my clinical hypothesis that many people that are diagnosed with muscle tension dysphonia, when they get to the laryngologist or the ENT who's finally looking with an endoscope, they probably had laryngitis because they had swollen vocal folds when the thing started. But by the time weeks pass and they finally get to the imaging part of the assessment, the temporary tissue change that might have triggered the start of the problem is probably resolved, right? And so then they're told, well, there's nothing wrong. Well, I'm not convinced that there wasn't something wrong to begin with, right? So that's how I think through it. And that sort of counseling, I think, helps people, gets them off the hook of feeling like it's my fault that this happened. And we need to get them past that so they'll focus on recovery.
Let's take a look at a couple questions. So Sandra writes in, I would love to hear some more information about thoughts on the distinction of how respiratory muscle fatigue might present as opposed to intrinsic vocal muscle fatigue. In the shorter term, would it be a coordination issue? And in the longer term, aging, might it present more as instability or a wobble?
I don't know if I can answer that, to be quite honest. Aaron, do you have any thoughts about that? We haven't isolated these subsystems.
Yeah, it's I think we're speaking hypothetically here, but I would think that, you know, if you think that if the respiratory muscles, they're the ones that are responsible for providing a nice steady subglottal pressure to the vocal folds as they're vibrating, that, you know, what happens when your muscles fatigue? They become a little less reliable. They don't generate as much force. And so those types of, I think that the instability that you mentioned in the question was right on track in terms of what potentially could happen with a respiratory muscle fatigue. I think, although it may just be that might contribute to an overall perception of increased effort to produce the voice. I don't know that we could sort of pinpoint specific, you know, voice signal manifestations of respiratory fatigue. You
know, I would hypothesize, though, based on the physiology, that what you would probably see is a less reliable ability to produce a long note, right, that was loud and at a high pitch, because that would require greater subglottal pressures. So, you know, you can imagine how singers at the end of a long rehearsal start to have more difficulty doing flexibility things and powerful things because they're probably wearing out. But we haven't really empirically studied it. Someone made a comment, is there evidence to support claims that we're making? I just want to be real clear. If there's evidence to support, most of what I say is evidence supported, and I hope I cite references and researchers when I can. I'm very careful to always offer a disclaimer that it's not been studied if it hasn't been, if I'm not aware of publications.
Thanks, Mary. Peggy, it looks like you wanted to
I was just going to comment on the respiratory connection and say that in the medical voice practice where I worked for many years, respiratory screening or PFT screening was part of the protocol because even a mild case of exercise-induced asthma can have a profound effect on someone who's striving to be an elite singer. And I can think of a number of instances where when that inability, especially in the 25 to 75% exhalatory ability, was compromised because of this mild case of asthma, when that was corrected, then the singer experienced less vocal fatigue. So, I mean, we know there's we know this is correlation, reliance in the system, but I don't know if that's helpful at all. But certainly,
no, it is, because asthma is a disease of expiration.
Exactly.
Right. And so if the singer has their phrasing down and the asthma's flaring up and they don't have the ability to hold out that line the way they want to, then they're probably going to recruit extra muscle tension just for musical purposes, right? So it sounds like, and they can deliver what the listener wants to hear, right?
Exactly.
Yeah.
Exactly. And certainly fatigue was a factor that did diminish with correction. And the other thing I did notice, and this is just observation but not scientifically backed, is that a number of the patients that I worked with who were asthmatic and it wasn't fully controlled, but they still sang a lot, it was very hard for them to keep the center of breathing low. And I'm not sure I understand exactly why, but the system kept getting high and clavicular. It was really hard for them to drop and release on inhalation, and that creates a vicious cycle. And the other thing I want to say about respiratory issues is, in all of the years I've done this, I would say that 95% of the singers I have worked with, even if they're high-level singers, if they have a problem at the level of the vocal folds, the breath, if it's been going on for a while, the breath support system has become somewhat hyperfunctional, and should always be addressed first. It's the simplest thing, like you're all saying, and we should just blanket look at that first. That's all.
Deanna McBroom says, can you address tender sore spots in laryngeal neck area as part of fatigue? Also use of laryngeal self-massage to soothe these spots. And I will say, Deanna, we did just this January, our NATS chat was on self-laryngeal massage. So there's a whole hour-and-a-half NATS chat out there with Marcy Rosenberg and Nicholas Perna, who had done some research on self-laryngeal massage. So you can find that on the official NATS YouTube channel or nats.org. But now I would love Mary and Aaron, if you guys want to address that.
Well, I would think if you're getting, muscle soreness that you can massage, we're not talking about the intrinsic laryngeal muscles, and we're probably talking about someone who is engaging those perilaryngeal muscles or the larger, cervical muscles more than they need to. And I'm always cautious in my language. I try not to speak in judgmental terms, that they're doing it wrong, that if the way they're singing isn't right, but rather I like to couch it in efficiency and just say that, you don't really need these big muscles to be so vigorously engaged. That's not helping your voice. It's leading to this fatigue. It's leading to the soreness. And so I think some things we were talking earlier about addressing the respiratory system and addressing the posture in particular. I find just, Mary, what you said, the alignment, I was very influenced in my training in the Alexander technique that I took. I just found that to make a huge, huge difference in my own levels of fatigue and reducing effort. And so I go to some sort of basic, getting the head back and then up this way, and right now, as I'm sitting at my computer the past 45 minutes, I just heard a little crack, and that felt so good. Like this, right? So those types of things where you're reducing the effort and the engagement of these larger muscles around the larynx, I think is really helpful. In addition, potentially to laryngeal massage, relieving some of the acute soreness.
I'm on board with everything Aaron said. From a muscle physiology perspective, folks might be interested to know that delayed onset of muscle soreness is more a feature of eccentric muscle contraction so you might think through if they are holding tension in an elongated muscle. Well, eccentric is loading as you stretch, lengthen the muscle, right? Instead of shortening it like picking up a box. So the way I describe it to my students, you pick up the box, that's concentric, you carry it, that's isometric, you lay it down carefully, that's eccentric. So that muscle soreness is because the muscle is probably repairing from being used in an atypical way. And so you might just, and that is something no one's, to my best of my knowledge, has really broken down the whole way that we use these extraneous muscles for voicing maneuvers in an eccentric, concentric, isometric way, but it might help explain some of the soreness if we were to, to examine that closer.
We have a great, thank you, Mary. We have a great question from Marcy, who I just mentioned. Hi, Marcy. She says, great discussion. Here are several scenarios that bring in a patient with fatigue. One of the most challenging vocal fatigue subsets that Marcy tends to see doesn't really have dysphonia at all. What they have is focal pain and fatigue with extended voice use. Vocal folds typically look normal in exam with this specific subset of patients, and she finds that they are more challenging to manage compared to other types of fatigue patients. These are typically males, 20 to 40, with a similar phenotype, lean, small frame. Have you noticed that at all in your practices?
I wouldn't say I have noticed that particular phenotype of male having trouble, but, and I'll let Aaron probably has more than I have, but I could hypothesize that maybe they have smaller pulmonary volumes that might be contributing to it if they are of smaller stature, trying to create the same acoustic target as someone with more pulmonary capacity, perhaps.
Yeah, I haven't noticed that specifically, but Marcy, it sounds like you've got a great retrospective study there. Grab all those patient charts and let's figure out what they have in common.
Yeah.
And ironically, Marcy, I have 3 or 4 CCM singers that fit that same exact thing, where they have been given it, they have this voice fatigue without any specific diagnosis. So that's interesting. about that. Yeah, go ahead,
Can I just
Aaron.
make a quick sidebar here? So what everyone just saw, this is how research happens, right?
Yeah.
Someone says, I noticed something, whether that be in the clinic or in the studio or in the lab, you know, whatever setting, they say, gee, I've noticed this pattern. I wonder, has anyone noticed it too? I wonder if it's something that I'm making up in my own head, or is it really hold water? Is this a pattern that actually exists? And so anyone out there who sort of has these moments of I wonder, I encourage you to either dive in and go do that study yourself, or engage with your local researcher if you can find one, or give me a call and we'll set something up and we'll do a study. But this is how it happens in these moments.
Thank you, Aaron. I love that. Kelly Host has great question. She says, what self-checks do you recommend on a daily basis for singers to assess vocal fatigue? Assessing pianissimo singing, onset, staccati?
I'm a big fan of the messa di voce. The clients and singers and patients kind of hate it, but I think it tells you a lot about whether they're able to elegantly, right, fade from pianissimo to forte back to pianissimo. And I think it tells me a lot about how they're able to, entrain the respiratory system and that really elegant subglottal pressure management with the change at the level of the larynx. And I think that could be kind of telling. Flexibility, I think, is a tell. If people are losing the ability to rapidly note change, right, is kind of a tell that they're tired as well. Mm-hmm.
I'm a Chicago guy and observed at Dr. Bastian's clinic. That's the very first place that I sort of saw what speech pathology was, and was lucky to meet and get to know Marina Gilman before she moved down to Emory when she was up at the Bastian clinic. So with that, I say that the Bastian swelling checks, I like the happy birthday, singing in a falsetto very high and as light as possible, and then sort of judging the top note that you can get to. I think that's a nice strategy related to that, sort of building off of that. There's two other tests. The NCVS, National Center for Voice and Speech, had a series of kind of questions and little tasks that folks could do, and then the MGH group sort of picked up that and narrowed it down a little bit with some of their vocal dosimetry studies. And it's I can't remember them off the top of my head, but if we have a chance to post references later, I'll try to send an email out. But I think that doing tasks is a really great thing to do, as opposed to just saying, is your voice fatigued? Questionnaires are fine, but like, let's actually do something and see, can you do it? Do you notice an increase in effort when you do this challenging task, which the messa di voce definitely is a very challenging thing to do. And the high and light singing, the idea being that you're just getting the edges of the vocal folds vibrating. And if there's any swelling, that task will require more subglottal pressure and more perceived effort. And potentially there might even be some breaks in the voice up around that upper passaggio.
Oh, voice breaking and cracking, I think, is a big red flag of fatigue, because the muscle just can't hold the tension anymore, right? So it just...
Or coordinate the transition of tension in the passaggio.
Yeah, I would say so.
We just put all of this in a context of the singer previously that day or earlier or whenever could do these things and now cannot. Mm-hmm. Because what we're describing as oral symptoms, that the problem with that is that many things, like with Dr. Bastian's test, many things can cause these issues of breathiness, and many things can cause cracking, and many things can cause an inability to do a messa di voce. So it has to, you could have a paretic vocal fold, you could have a mass, I mean, any number of things. So just to put it in context for the listener, we're talking about someone who could do that earlier and now after singing cannot do that. Is that correct? Is that what we're saying?
Thank you, Peggy. Absolutely. Yeah, thank you for making that clarification. Thank you.
Sure. Yeah, there's an assumption we're dealing with a generally healthy singer who doesn't have a laryngeal diagnosis, right? Or other health condition that might become like COPD, for example, right? Or something else that might promote fatigue.
That was like the singer that I evaluated who was saying that he was having problems with his high Cs. And I said, well, when did you first start noticing that difficulty? Oh, I've never been able to sing a high C.
Right. Yeah. May I just also clarify too that And you started the conversation, we started us off at the top with this, Erin, but for people that joined us a little later, we're talking about muscle fatigue. We're not talking about cover fatigue. That's a different construct. So I just wanted to clarify that.
Could you explain to the average folk listening, when you're talking about cover fatigue, you're talking about the surface of the vocal fold, right? Tissue fatigue?
Tissue.
Well,
or not? No, sorry.
The honest truth is, Peggy, I'm not sure that the cover fatigues. And the reason why I say that is because we do not have a physiologic paradigm for the epithelium and superficial layer of lamina propria to fatigue. Does it become inflamed? Does it get micro tears or something from phonotraumatic behavior? Probably yes, right? But the whole, and maybe it upregulates to mitigate fatigue like the muscle does. There's a lot we don't know about it. The thing about muscle fatigue is though, there's a lot of basic research done on the paradigm of muscle fatigue that we can use as a foundation to study, the muscle fatigue in the larynx as we chip away at it slowly with this hard to get at structure, right? But the whole cover fatigue thing, I think we need a lot more research to really understand what that means.
And I wouldn't call it fatigue. I would just call it some sort of change.
Yeah, I would.
The integrity of the cover. I wouldn't call it fatigue either, but just to differentiate for the folks who are listening, you're talking about muscle fatigue as opposed to something going on with the vocal fold surfaces themselves.
Yes.
Is that correct? Okay.
Yes, that's correct.
Thank you.
And with somebody reporting, it kind of feels tired in here, it feels sore in here, it just feels whatever. I'm aware of a feeling in here is what you're referring to. Yes, Mary, that you assume that's a muscle fatigue.
Well, I mean, certain kinds of pain mean vocal fold granuloma. We know that, right? If it's in a certain spot and happens at certain times, it can signal that. It's a complicated topic in that if something's wrong with the cover, if there's a polyp there, perhaps, or if it's a pretty stiff nodule, that changes biomechanics in a way that someone might have to entrain more intrinsic laryngeal muscle tension to actually get the vocal folds going. So they're not unrelated. The health and well-being of the cover is completely part of the story. But in someone without laryngeal pathology, the kind of fatigue we're talking about is really more muscle related and not cover related, I would say.
Great distinction. Erin, you mentioned the dosimeter, and we talked about that we might mention that. Do you want to just go there for a couple minutes?
Yeah, I mean, vocal dosimetry has been around for a couple decades now, and it's a great tool. And what it is generally it's a small accelerometer which picks up vibrations or movement, and it's placed at the sternal notch typically, and then it's connected. In the past, the first one at NCVS was connected to a little pocket PC. There's quite a bit of work done up in Boston at MGH now, headed by Bob Hillman and his group, looking at that connected to a smartphone. And there are, sort of the next generations. I mean, think about Fitbits and, all this tracking we're doing of our activity. The idea of the vocalocimeter is to track vocal activity throughout the day. It's an area I've long been interested in, and I'm starting to get into in a research aspect, which I'm really excited to have that opportunity. And what we can do is use that accelerometer to measure the vocal signal almost directly. We're getting the vibrations on the neck, which correspond to the vibrations of the vocal fold. So you can measure fundamental frequency, you can get a proxy of intensity, how loud the voice is, and then you can measure some spectral aspects of the voice source as well. And in doing so, I think that is now opening the door for us to understand patterns of voice use. So as opposed to someone coming to the clinic and saying, my voice gets tired, or if you see your student in the studio once a week and they say, yeah, I got really vocally tired on Tuesday. By using devices like this, as they hopefully become commercially available soon, or they haven't, that's another story, but as they continue to become commercially available, we'll be able to start using them to actually quantify not only the voice use, but then to have someone, press a button on their phone or somehow measure when they're becoming vocally fatigued. And we're going to start to have better answers to some of the questions that were asked earlier tonight, like what's the reset, like resting throughout the day, or the vocal bank analogy I was saying earlier. You want to build up your balance in your vocal bank by doing a little vocal nap, which is a popular kind of strategy. Well, how long should that vocal nap be? How long of vocal rest throughout the day? I'm talking not days and days, but 5 minutes, half an hour. Will that contribute to less vocal fatigue? And so I think we're going to be able to quantitatively understand this in much more depth in the coming years.
Oh, and this stuff. So here's where it gets very interesting, right?
Oh, yeah.
Ingo and Ingo, Speck, and Popolo published a paper in 2003, and they described the vibrational safety limit for the vocal folds, and they set it at just over a kilometer of accumulated vibration. A kilometer, which sounds like an enormous distance, right? Well, Sharon Moore, right. And I'll point out this microphone that Aaron's describing is far more accurate than collecting the acoustic signal at the mouth with an external mic. It's very accurate. So it's good science. Sharon Morrow and Nadine Connor, and Sharon Morrow's, I think it was her Doctor of Musical
DMA project, yeah.
She published 2 papers, one describing the distance dose for classroom teachers, elementary school classroom teachers, averaged over 5 days. So they measured it 8 hours a day for 5 days and then averaged it, compared to elementary school music teachers, right? So the classroom teachers' vocal folds averaged about 3.5 kilometers a day of total vibrational distance dose. The choral music teachers, or elementary school music teachers, 7,000 meters, 7 kilometers of accumulated vibration. Now, here's the thing. I have her data because she retired and gave me this data, which is amazing. One teacher's vocal folds traveled 18,000 meters in one day, in one 8-hour workday, on one of the days of the week, and another day traveled 3,000. So 18 kilometers of accumulated vocal dose. I mean, all the dosimetry data that they're collecting blows way past this 1 kilometer distance dose safety limit that's been proposed. So obviously people are able to do it, right? And what's the difference between someone who can do it and not develop voice fatigue or develops a pathology versus someone who can do it really well? And there's a lot of science we need to do to really get at why that is.
That is fascinating. Let me get just a couple more questions here as we come to a close. Do cervical spine issues like nerve impingement or severe degeneration contribute to voice fatigue?
It's a good question. Well, again, voice fatigue broadly, we've talked specifically recently tonight about the cover swelling potentially causing an increase in pressure or muscle engagement. We've talked about the muscle itself fatiguing, but ultimately this concept of vocal fatigue that we opened with is multidimensional and has the cognitive component. I would think that any sort of nerve impingement that could affect either there's pain in the neck because of that, or decreased muscle function could definitely increase the perception of effort and fatigue with the voice. But that's just more me just sort of thinking about it. Yeah, Peggy, you wanna?
One quick thing, with any chronic pain situation, there's cumulative muscle bracing or tension. I mean, I've never seen anybody that didn't have it. Yeah. So there's gotta be cumulative tension that is counterproductive and increasing the inefficiency that goes with pain. Even if it's not a direct, it's an indirect, perhaps, result of that cervical problem or other chronic pain issue.
But at the end of the day, nobody has studied that specifically.
Right.
So, yeah.
Sorry, I'm backing up just a second. Somebody says, does air pressure increase the distance? I assume that's when we were talking about dosimetry and the kilometers traveled.
Yeah, there's calculations in terms of some assumptions in terms of the amplitude of vibration based on the amplitude of the signal and the fundamental frequency. So it's one of Ingo's complicated formulas. But yes, if subglottal pressure increases, then amplitude of vibration increases and the distance traveled increases.
Right.
And can you discuss muscle fatigue as it relates to hormonal changes in women every month and menopausal women as well as men as they age?
Wow, that's a big question.
It's a really good question.
Excellent question. Well, in terms of age, all of our muscles, including the laryngeal muscles, get smaller and weaker as we get older, starting in our 30s gradually and then progressively getting faster as we get older, unfortunately. Whenever I talk about aging, it always sort of starts off pretty sad. But at any age, we have the capability of training those muscles to slow the inevitable decline and or increase their function. So it's not all lost. So yes, there also are definitely differences in the way we age between cis males and cis females. Without a doubt, I would say we have a nascent understanding of that. My former student, Dr. Charles Linnell, who's now doing a postdoctoral fellowship at University of Wisconsin, the effects of hormones in the voice is really his overarching research interest. And so he's done some preliminary work with his dissertation and is continuing that. So I think we'll know more about that on a mechanistic level with his work. And yeah, I could go a long time, but that's a big question.
Yeah, I've also done some hormone work with
Yeah.
reproductive and postmenopausal women, and we've got another paper that actually was just accepted on high-speed parameter differences between, and you know, we didn't do a fatiguing task with our participants, so it's hard to know exactly how this happens. I can tell you as a almost 55-year-old postmenopausal woman, though, that my voice is very different than it was for reasons probably maybe unrelated to muscle and more related to probably cover, viscosity, and some other things that are inherent in aging in general, but also with hormone changes with menopause. So these are always incredibly complicated because there's so many physiologic things that you have to account for when you're studying it, right? So yeah, these are great questions, great research questions. You know, maybe in my next iteration of this stuff, we'll do a fatiguing task, right? So, yeah.
Well, as we wrap up tonight, any kind of last thoughts about what you want singers or singing teachers, like signs, things that we should look for around fatigue, just any other final thoughts for us as a community of voice teachers and singers?
I would just like to propose that fatigue is not evil. Fatigue is not a bad thing. It's not something to be avoided. It's something to be planned for and something to train up to be able to be more resistant to. I mean, we're great at skill acquisition in singing training. I think we're great at, you know, shaping voices that sound really great. But that training up to be fatigue resistant so we can show up tomorrow for another show is not something we've given as much thought to as we probably could. And I think that's going to be an important improvement in our ability to help occupational voice users in general.
Mm-hmm.
I would take a sort of a vocal health slant to my final statement, in that vocal fatigue, as I've said many times tonight, is a complicated, multifaceted concept. And so when we're talking about training the muscle as part of the way to combat fatigue or plan for fatigue, we're really speaking about that muscular level. But someone who's experiencing vocal fatigue, that could be caused by many, many different things. Peggy, you made the point earlier about, you know, talking about if someone has symptoms of dysphonia or difficulty in the passaggio or difficulty with messa di voce, right? If there's sort of some physiological consistent problems, those could be caused by many things. So I wouldn't ignore fatigue. I wouldn't chalk it up to, well, that's just normal, you've been singing a lot, and you know, look for these problems in your singers and in yourself that are sort of unexplainable, or you know, if you just sang an entire aria or entire opera and you're tired, okay, fine, you know. But if every morning you wake up and you're still a little sore and it's this persistent issue, then go get that checked out. Right? Go to your local voice specialist and get an exam and make sure there's nothing else that's going on.
Well, and not to, oh, sorry.
Are we done? Sorry, I just had a question for the two of them, just very fast. So if a voice, just from the perspective of a voice teacher, so a singing teacher is working with a student and the student says, I'm beginning to get tired. Do they allow the student to rest? Do they ask him to do an SOVT or something to help, you know, release tension, or
Question.
should it be addressed?
I would dig into that and say,
fashion?
yeah, I would say what do they mean by that? Like, what is tired? Is tired just you know, they were up late last night and they're just generally physically fatigued, is tired for them. They're starting to get sore here or in the neck. SOVT, I saw the question come up, semi-occluded vocal tract exercise, of which there are many, from the simplest of just humming to using a straw and water, as we talked about earlier. You know, and I would say doing some gentle vocalization to see if that helps relieve the fatigue. Then maybe that's sort of an efficiency problem, as I was describing earlier, about using too much of the muscles than they need to. Maybe that's contributing to it. But I wouldn't just immediately say, okay, go rest. I would sort of dig into it and try to parse out what exactly they mean, and with the student try to figure out why might they be fatiguing. Is there an obvious reason, or is there something maybe subtler going on that we can't identify? In which case, yeah, maybe take a rest and come back to it later.
Well, and then the other thing is, you know, students don't always tell their teachers everything they're supposed to. I mean, I've treated people for vocal fatigue who did not tell their singing teacher that they were a music minister at a church and they were in 5 different ensembles, and their studio teacher thought they were only in opera studio and their singing lessons preparing for their senior recital, right? So it's like, yeah, you're fatigued for a really good reason and you should be doing less probably, right? And so I think, yeah, digging deeper is really important.
And Mary, you mentioned something during our pre-chat that I think we should just mention tonight. As we hopefully come back into the world post-COVID, there's going to be a lot of singers that perhaps took a time out and they're going to have to retrain. Do you want to just, either of you, both of you, mention a little bit about strategies for that or thoughts?
Let me tell you something, folks. My sister had COVID last October. They just diagnosed her with a partially collapsed lung this week that probably happened then, and she's just been going about her business thinking she was feeling anxiety in her body when actually it was pain, chest pain from a partially collapsed lung. So I just cannot reiterate enough that people really need to make sure that they do due diligence in figuring out what their pulmonary health is if they've contracted, or maybe maybe they had COVID and they didn't know it, but it's showing up in some pulmonary differences with breath support. So it's never wrong to refer them back to the doctor to get more information about how their pulmonary system works. That's one thing I would say. The other thing I would say is plan time to get back in shape to do the work, and encourage your singers to be gentle and kind with themselves in as much as they're able to, you know, voice build again. I know some people, they're not going to be able to pay rent if they can't get back doing what they want to do, but they should start it now. They shouldn't wait until their next paid gig is 2 weeks from now, right? It should start sooner than later, and then try to get in shape and stay in shape as much as possible.
Love that. Well, thank you, everyone. You know, I've been so looking forward to this chat all season, and it far exceeded my expectations. So thank you, Dr. Sandage, Dr. Johnson, for joining us with your expertise, and Peggy, as always, for co-hosting with me so eloquently. And let me just remind everyone, April 11th NATS chat will be 2 more legends in our field with Dr. Ingo Titsa and Kitty Vertolini, Dr. Kitty Vertolini as well, both of whom have been mentioned tonight and are mentioned frequently. So please join us April 11th for that NATS chat, and have a very, very safe rest of your March, and have a good evening.
Thank you, everyone.
Thank you. It was a real pleasure being here. Great seeing you all. Stay safe and healthy.
Mm-hmm.